Question 51. Managing a colleague's medication issue. You notice a nursing colleague taking dexamphetamine for her ADHD, and she requests that you keep this confidential. What is the most appropriate initial action? A. Report her directly to SOMA. B. Inform her supervisor. C. Respect her privacy and do nothing further. D. Ensure she is on proper psychiatric follow-up. E. Advise her to use a less dependence-inducing medication. Correct answer, option B. Inform her supervisor. Explanation. When a healthcare professional's practice may affect patient safety, the recommended course is to inform her supervisor. This allows appropriate evaluation and support, while respecting both professional responsibilities and patient safety standards. AFRA Guidelines for Reporting. Question 52. Management of postpartum psychosis. A 30-year-old woman who recently delivered by Venthouse is now experiencing poor self-care, has stopped breastfeeding, and believes her baby is evil. What is the most appropriate initial management? A. Initiate clozapine. B. Start quetiapine. C. Administer emergency electroconvulsive therapy, ECT. D. Start olanzapine. E. Begin risperidone. Correct answer, option D. Start olanzapine. Explanation. This presentation is suggestive of postpartum psychosis. The initial management involves starting an antipsychotic medication, with olanzapine being an acceptable first-line choice in managing acute psychosis in the postpartum period. RANCP, Postpartum Psychosis Guidelines. Question 53. Plantar skin lesion. A picture shows the plantar aspect of a foot with multiple raised, hyperkeratotic bumps and a clear interdigital area in a healthy, active individual. The lesion is not painful. What is the best treatment? A. Corticosteroid cream. B. Emollient application. C. Salicylic acid ointment. D. Cryotherapy. E. Topical antifungal cream. Correct answer, option C. Salicylic acid ointment. Explanation. The description is typical for plantar warts caused by human papillomavirus. The first-line treatment is a keratolytic agent such as salicylic acid ointment, which helps remove the hyperkeratotic tissue. Australasian College of Dermatologists, Common Warts. Question 54. Evaluation of secondary amenorrhea. A divorced woman presents with a 12-month history of amenorrhea. She reports no sexual intercourse in the past year, and her physical examination is unremarkable. Which investigation is most likely to lead to a diagnosis? A. Measure FSH/LH levels. B. Assess estrogen/progesterone levels. C. Check serum beta-HCG. D. Perform an abdominal ultrasound. E. Evaluate TSH levels. Correct answer, option A. Measure FSH/LH levels. Explanation. In the evaluation of secondary amenorrhea, the initial hormonal workup should include gonadotropin measurements, FSH and LH, to distinguish between ovarian, pituitary, or hypothalamic causes. RANS-COG, Amenorrhea Evaluation Guidelines. Question 55. Management of a tic disorder in a child. A child experiences sudden, uncontrollable urges to lift his arms at school. Despite his attempts to suppress these movements, they are disruptive and cause embarrassment. What is the most appropriate management? A. Administer alprazolam. B. Start risperidone. C. Use haloperidol. D. Offer behavioral therapy alone. E. Begin clonidine. Correct answer, option B. Start risperidone. Explanation. The clinical scenario suggests a tic disorder, such as Tourette syndrome. In children whose tics are severe enough to cause distress and functional impairment, a second-generation antipsychotic, like risperidone, is recommended as first-line pharmacotherapy. RANCP, Guidelines for Tic Disorders.